believe if I say welcome to Lira, specifically to run videos, I'm very excited. I want to first thank Ministry of Health here represented by the team that has come from there. And I would also want to specifically thank the UCREP leadership for having taken part in interacting with Lango sub-region and specifically Lira Regional Referral Hospital in coming up with this facility that we are now in. I want to observe protocol by recognizing all of you in your various capacities. I'm quite excited to see that today I've also learned that there are really very many media houses in this country that probably I've even never heard of. So in your various capacities, I really want to appreciate and welcome you to Lira Regional Referral Hospital and also to Lango sub-region. This is our area that we serve. Some of you may not know that Lira Regional Referral Hospital is an MDA of Ministry of Health. We are an independent entity, but under Ministry of Health. Sometimes people tend to confuse and think that probably the DHO and the CAO of Lira district, or probably the mayor and the RCC of, including town clerk of Lira city, is where we report to. I think I want to clear that very, very well, that the hospital is a vote by itself, and we are vote 412 here under Ministry of Health, and under Ministry of Finance we are a self-accounting entity, with the head being the hospital director. The new name that comes for the hospital director is the chief executive consultant, and that is the head of the hospital. The area of jurisdiction for the hospital takes cover of the 9 districts in Lango sub-region and the 1 city, that is Lira city. So Lira Regional Hospital takes on the districts of Otuke, Angolata, Yokolo, Alebtong, Molata, Oyam, Apach, Kwania, Kole, Lira district itself, and then the city. Have I repeated N or not mentioned N? Oyam, I mentioned it. So 9 districts and 1 what? Cities. That is our area of what? Jurisdiction, and that is the place called Lango sub-region. That the regional hospital, when we talk of a region, there is also the Acholi region with the various districts. I just needed to bring that such that when we are sharing, we know that we are talking about Lira Regional Referral Hospital representing and taking coverage of that area. I want to say that certainly as a government entity, there are a number of services that are taking place here in the hospital. In the recent past, probably if you can rewind your time and get to the previous last 3-4 years backwards, you'll see that the hospital is now quite different from what it used to be, because a number of development activities have taken place. Certainly, this is all ascribed to the good leadership of our head of state, with all the various structures and ministries that are in. But I also want specifically to mention that if you are a commander and you don't have good members that are willing to work with you, it may not be easy. I also want to really recognize the input of the Ministry of Health, led by none other than the person who is within here, that is Dr. Ruth Acheng Chero, and her team, the PS Ministry of Health, and all other directors and staff. I also want, on a very serious note, to recognize the input of the local leadership in Lango sub-region, beginning from the city and then the districts, because it is this combined effort that has been able to make us walk through this journey from where it was to now what we can appreciate and say there are numerous developments that have taken place in this hospital and in this region. I stand here to represent the hospital director, Dr. Nathan Onyachi, who is on leave, and also the deputy who is predisposed. He's actually sick, but nonetheless we are able to move. In the interest of the purpose for which we are assembled here, I will take it that I want you people to feel free. This is a government entity. It's a public entity. We would wish to see that the outcome of this activity should be able to improve on the health-seeking behavior of the people where in the region, and have them informed of the various services that they may not be aware of, and be able to utilize these services that have been established. You always hear the president saying PDM, so this is also part of PDM. I have to put it like that people need to know and should be able to take on the services. My fellow colleagues and friends, I want to say certainly in doing all these activities, it takes the effort of the leadership of the hospital. And I also want to appreciate the hospital management board, that is the major guide to us, the management of the hospital, in trying to see that the various programs, activities and services that are being provided in this institution are of quality. And indeed, that is reflected from now the number of patients that we do receive coming to seek for services here in this hospital. I'm not ashamed to say every day that passes, this hospital sees over 400 patients or clients. That is only in the outpatient department. As we shall be walking around, you will also see that there is a lot of overcrowding inside the wards. And certainly, this shows you that people come to take on the services. We have run a number of camps that have covered the vast area of Lango sub-region, but also extended a hand to Teso and Acholi regions, where people have been able to benefit from the services that are offered. Before we may usher ourselves to the real gist of the matter, it's also good to mention one or two of the key challenges that the hospital meets as it delivers these services. And this is also part of what we would wish to see if service delivery should improve in this region. The key issue is this hospital started or was opened as a facility serving soldiers at that time in 1928, until it grew up to a district hospital until 2003. That is then when it became a regional referral hospital. So it is that old hospital with old structures of that time. But we've kept on trying to improve it, to provide space in order to be able to accommodate the clientele that we have. And that's why, once again, I say this facility we are in is part of that infrastructural expansion. We believe that this lab now will be able to house and have a real home a one-stop center for laboratory diagnostic services here in Lira Hospital and serving the entire region. The big problem the hospital has is limited space, and what we try to advocate for and lobby for in government is the possibility of having a ward complex. If you look at the hospital, as we shall look through, the buildings and the wards are scattered, and that causes a lot of uncoordinated movement. Yet a ward complex would be able to house one where you're having all the various wards, you have the theater, and then say that service delivery is contained within. That is one big problem that the hospital has. Space. The structures are quite old, but we have taken on it as management to say, let these structures, though they could have been condemned, but we can't demolish a building, yet we need a ward for the children. You will see how many children share a bed in the pediatric ward, and see how many mothers and how they are being handled, especially after delivery because of the limited space. I'm basically answering the issue of overcrowding that you may see in the hospital. Besides that, I wouldn't want to go into any other smaller nitty-gritties of these other problems, but I also want to say, in the last 3 years, this hospital has managed to attract a number of specialties. We are now proud as Lira Regional Referral Hospital and the Lango sub-region to say we have almost beyond 15 specialties taking place here in Lango. Talk of ENT services here, not crowd, orthopedic surgery. What would you, ophthalmology? You've seen the teams going out for camps and splitting eyes, obstetrics and gynecology, and the like. So at least this is now causing a big improvement, and we receive patients, leave alone in Lango sub-region, but covering the entire Karamoja, Bim, Napak, Karenga. The Noya side comes here, and then we have our catchment side of Teso, the Kaveremaido, and the Kalakis. They come here to take services. So really, I'm happy that as media houses, we are here to pick on and see how we mobilize our people to be able to benefit from these services than the hospital being a white what? Elephant. So I believe this interaction will avail us an opportunity that will help us do that marketing. Madam, I may have touched not much on the overall objective of this meeting, but I felt those be my opening remarks as I welcome the team to Lira Regional Referral Hospital. Thank you for listening.
The need for medical care, so forth and so forth. I wouldn't want to go into those details. So the World Bank was able to provide some funding to the Ministry of Health, to the government of Uganda through the Ministry of Health in this project. And it is this project that has been at the forefront of an outbreak after COVID-19. If you recall, we had COVID-19, then we later got Ebola, then we had Marburg, then recently there's Mpox, now there is an outbreak in Rwanda. So every outbreak that has come after COVID-19, when this project is in existence, we entirely carry it on. And what do we do? Of course, we look at prevention because the disease is within the people. So once we have victims, once we have suspects, we dispatch surveillance teams, we dispatch medical workers, and set any emergency services that is needed to manage those pandemics. So this project has basically been at the forefront of managing most of the pandemics. We are in 5 components. Maybe I can talk about the project objective: to prevent, detect, respond to COVID-19, and strengthen national systems for public health emergency preparedness in Uganda. Strengthen national systems for public health emergency preparedness in Uganda. So when we got an outbreak, by God's grace, we were able to wipe it out. But what next? The lessons we learned from the pandemic. We learned we had limited resources. We got to understand that we have limited oxygen plants. If you remember the time when the price of oxygen was almost the equivalent to selling your own kidneys to get it. It was like an eye-opener to the Ministry of Health that there are certain things we need to address so that we get prepared for any other emergency. So that's why there's that aspect of strengthening national systems. That's why we came up with systems, with things like this lab. If you recall, during the pandemic, you would test and then they send samples to Entebbe, and then they run the samples, and then after 2 days they will tell you either you're positive or negative. But we came up with two regional referral hospitals as pilots to hold satellite laboratories. One is here in Lira, another is in Fort Portal. So, and this lab will be able to test any disease. We shall not transfer the samples to Kampala to Entebbe. We shall not look for specialists in Kampala. So, because of limited resources, we want to be almost in every regional referral hospital. But now we are starting with these two. And this is one of our first babies when it comes to the civil works that we have. And we are proud as you that this project is coming to completion. We are in 5 components. The project was effective in 2020 and it will be completed in 2024. So we have like 2 months to go. So component 1 is in case detection, confirmation, contact tracing, recording, and reporting. Just like I said, we get the suspect that there is Ebola in Lira Regional Farm Hospital. We dispatch teams, we alert the hospital administration that there is actually the hospital administration alert the Ministry of Health. So we dispatch resources. Resources are in PPEs, resources are in specialized healthcare, resources are in paying allowances, resources are in maybe in establishing isolation centers. If there is no isolation center within a facility and there is a suspect, you will, in the later process, you realize that in some places we even set up like tents to isolate suspects from the health people so that we manage them and they do not spread the pandemic. So component 1 is in that case. Component 2 is in strengthening case management and psychosocial support. What do we do here? This is where we have ICUs, and as a project of 3 ICUs, we are constructing one in Arua, another in Kabale, another in Hoima. I will not go into details of how we wanted ICUs when we were under COVID, but we also realized that those are some of the facilities that we need to have in these regional referral hospitals than waiting to go to Malabo for an ICU service. Then also psychosocial support. Sometimes we get sick and we get mental injuries, if I may put it that way. Up to now, we still have victims of COVID. People who lost their dear ones during COVID. People who got sick and have not fully recovered mentally. Even mere hearing an ambulance, their system goes back to where we are. So we have support in that way. But this psychosocial support is basically now in the refugee districts. We have a Department of Mental Health that conducts this mental and psychosocial support. We have component 3, project management and monitoring. That's really the internal operations of the project. I'm not going into these details of component 3. Then I've got component 4, which is vaccine acquisition and deployment. In the next slide, I'll show you the funds that were dispatched for the vaccine, but the COVID vaccine that was procured was through this project. And also the dispatching, the transport, the logistical bit was also covered by this project.
Of this project. The contractor is Techno3 Uganda Limited, and they are the ones who are taking on the work. This project started, we started work on 23rd of Feb 23, and was commissioned by the Minister of Health, Honorable Lusa Cheng, on the 6th of April 2023, and was to take 15 months. And the 15 months elapsed in April, and then we added more 4 months. So far, according to our estimations, we are almost at around 96% completion of this project. As you're going to see when we move around, because we are only left with a few of the finishing and polishing, which can take maybe like 1 or 2 weeks, and we shall be done. So that's why it's around 95-96%. But to be more specific, it is at 96% completion. So I think we can now move around. So where we are now, this is the boardroom, or to be the train, like for trainings and other studies. This one is going to be for waste. All the waste from the lab, the solid waste, the solid can be put in maybe in polythene, the one which are recommended, then will be coming with the lift. This will be a collection point. We are going to put a screen so that it does not interfere with the users of this corridor. Then it will be taken away. So we are having a camp here, then down the other side we also have another one. Another one will be for most of the reactions. So they will have to see it. It's not there. This is what
is key also that throughout the process of the life of this project, the hospital took lead as chairing site meetings. And you know, site meetings are critical in ensuring that we get exactly what we want. We also involve the city leadership, the physical planner, the valuer, the environmentalists, all that team participated. So it is a fully well-formed project. When it reaches time for its commissioning, you know that the city has a duty to give an occupational permit and also see that the structure is fit for occupation. I just felt I should mention that.
Processing and the distribution. Then inside there's a storage. So for biorepository, this is where the biological material samples like urine, blood will be collected and then stored. That side is biological material samples, urine, blood, DNA, human protein, all that will be stored here.
Now, when we check in the current lab, you will see that the issue of space that we were talking about gets clearly seen, because the other side did not have these provisions, because the building was just basically improvised, if that is the right word. That the building was a building, but it had to be improved just to accommodate. But now the structure has been planned and structured in such a way that there is all provision of these rooms that will take care of the laboratory requirements.
They'll be kept here in the shelves, and then there is a receiver's desk outside. So most of the times, That door will be closed most of the times, and they will be getting the readings from the receiver desk, which is on the next door. Yes, now proceed. This is the cold chain room, which will be for storage of vaccines, as Doreen was saying. So this one will be basically fridges for the storage of vaccines. And this one will be the lab manager's office and the quality officer's office. We shall have to partition them at the lab manager's the other side and then the quality officer side. This one is the server room, that's for communication, and all the fittings are already there now. The correct sample from patients from here. Then here we're having grouping and post-matching space. And then inside there is a blood bank.
That right now we are having as a blood collection center that is able to process blood. And what is coming in for Lira is that we are going to have a fully-fledged blood bank for Lango sub-region, for which the land has already been secured from the university. Now, this blood bank at the lab serves in as like when the blood bank has collected blood, people's staff do not pick blood from the blood bank, but they come to the lab, and that is where the blood will now be dispensed to the patients in the wards. Do I make any sense?
Yes.
Yes. So this is where the blood will be requisitioned before to take the patients in the ward.
Then this side will be for the reception and archives or records.
Let's move.
You give us a link.
The link is not in our scope, but the provision will be there. So on our first floor, naturally this floor is having most of the laboratories. We are having the media preparation, the microbiology, TB lab, immunology, histology, washup room, PCR1, PCR2, the molecular biology. We are having serology, chemistry, and hematology. So almost this floor is having only labs. And also to note is that all the lab sinks, they are having their own line, and we are having a decontamination chamber down there. So everything that is from the lab, the liquid waste, all the liquid waste, yes, it has to flow up to the decontamination chamber. It is decontaminated before it joins the main sewer line. So it is not connected with the line of questions.
I think what is key here to note is that the lab is associated with a lot of chemicals that could be hazardous, dangerous to the community. So, before that affluence is disposed of, it has to be decontaminated, so that when it now goes out, it is no longer dangerous to the community. The various laboratory tests that he has been talking about are the provisions we are saying this lab will now be able to be a home to house laboratory tests. That's why you hear biochemistry, histology. Those are all the various units in the lab that undertake the various tests. And that's why we say this lab will answer the needs of the region. Not again wanting to take some other samples, probably to either Mulago or to Tabika in the lab. And that is why when Dorothy was presenting, she said the lab was supposed to be accredited by FANAS and then reached in what is called the International Standard Organization, ISO standard. the tests that are done here will be similar to the tests that are done elsewhere, and it is standard. That is what it means. Thank you. At a certain time, we could have heard about existence of the police portion of the road that passes in the middle of the hospital, and that separates the main inside of the hospital from the outpatients department. But you'll see that the setup of the floor of the lab is such that it should be more nearer to the outpatients, because that is the beginning point and the entry point of the patients to the hospital. We were able to achieve that, and that's why you see that the positioning of the lab is next to the outpatients department. Let's
What's basically this laboratory comes with the cause of the campus preparedness, spreading campus preparedness, testing the samples for critical outbreaks, and those high-end laboratory services. So therefore testing for outbreaks and things like that. So what does this mean to the region in terms of the outbreaks and detecting diseases?
I think let's not coin it straight that the lab comes because of the response to related emergencies. But the clear fact is that this hospital did not have a real structure that was intentionally structured, planned to house a laboratory. And that's why you see that as we shall move, the structure that currently houses the working lab for Lira Regional Referral Hospital was an old structure that was improved. So this lab now comes as a space creation to have a functional lab with all the various services a lab is supposed to provide, including being able to be prepared to respond to emergencies that come. So that's why you see the various tests, what you'd call lab departments, histology, biochemistry, something like that. So that is showing that is now able to. So to the region, the fact is that this lab is now able to handle the various tests, be it of emergency nature or otherwise the normal tests that should be taken to support the physicians in the process of being able to clearly identify what is being treated, and that will improve on our prescriptions and probably medicine use and also prognosis, that is the recovery process of the patients. I think that is it.
What makes you proud of this intervention?
What?
What makes you proud of this project?
Are you not proud yourself to see that you're able to test, you're able to respond, you prescribe, you're able to give the right medicine, you cut on the costs, don't waste on medicine. That is the whole pride of not me alone, but for the region. But since you've asked, I will answer it in the context of the health workers in the region. That we feel happy now that we are able to do our work properly. Because what informs prescription is proper what? Diagnosis. So once you diagnose properly, then you are able to make the right prescription, and then you'll be able to treat the patient. Incidentally, this lab, like it's already started, there is what is called a global scare. That is antimicrobial resistance. Sometimes people even talk of the Now, we are already doing antimicrobial testing to be able to know exactly if it is syphilis, which is the main STI, say, prevalent here. We are now able to know that you no longer may use this medicine, but this is the right that you should prescribe. And that helps us also to improve on our medicine planning and supplies. Not buying medicine which is not responsive to the what? To the conditions.
What is the total cost of the project?
You'll be told about it, but it's about 3.9, call it 4 billion. The first area is just where we've been. That is the Satellite what? Lab. Now here is where we're going to have what is called the Ambulance Dispatch Center. Ambulance Dispatch Center. Like Doreen had mentioned, that for the purpose of responding to emergencies, the management of ambulances in the region, as you're aware now, there are a number of ambulances. Almost every district, I think, has an ambulance. Leave alone those that have been donated by the MPs and individuals. So there is a system coming in place where such ambulances are coordinated. What does it mean? That there is somebody here who, if there is an accident, say in Otuke, is able to say, Otuke, how is the ambulance? Alebtong, can you help? As Lira is trying to what? Say that, you know, the movement of the patients is made what? Faster. If there is need to move a patient from here again for further referral, especially for super specialized services. Super is like when you talk of heart institute, cancer what? Institute, where specifically they are specialized in those areas. So this is now where we pick on an ambulance, and I will tell you that Lira also benefited from a Class C ambulance, which is a full what? It is a full ward. You have the oxygen, you have what is required, like you're in a ward, but you are being transported to the next what? Facility. Leave alone this ordinary ambulance, which is just for what? For transportation. So we have that kind of ambulance here. So this is a new facility that is expected probably come this November. It should also be nearer to being what? Handed over. But this is now where we are. The next facility there is the oxygen plant. Like we are going. With this van, they are able to do an X-ray and be able to test whether you have what? TB, and also to be able to treat TB. And this van is used, it's available for the entire region on a schedule. Say the DHO of Apache or of Otuke will say, I've mobilized, come and do the work. It goes to the villages. Vans are meant to transport infectious waste from the facilities and take them where? To Alere for final what? Incineration. For the meantime, since Alere is not yet functional, they are here for safe what? Custody. I hope you are seeing. Ideally, it was condemned, not fit for use. But there is no way we can break this word when there is no alternative. All we did was to try to give it a touch of a paint, the roof, and you're seeing it is being used by the what? The patients. Until we get something which is what? Better. I'm trying to qualify the need for a word what? Complex. Now, just to comment, there was it's okay. Wheelchairs, trolleys, and whatever. Initially, we had a very big problem because from accident and emergency, through that road that was contested, you'll find these trolleys will be moving on a scattered, thorny road. These things were breaking almost over time. So we had now to think and say, let's have a direct connection between the accident and emergency outpatients with the what? The inpatient. That's why you see like we are now able to roll, and we're trying to see that the whole hospital is what? You can move throughout the whole hospital with a paved. The structure we're in now is the new oxygen plant. When you do your work, there is no problem. But just see. So, this new oxygen plant is of a higher capacity. And this is the kind of similar facility that is in Barara and I think in Fort Portal and somewhere. It's near complete to be able to produce what? Oxygen. The oxygen produced here is also meant to support the lower what? Facilities in Lango sub-region. Of course, sometimes when there are shortages, other regions may also come to request for oxygen here. But the plant is now with us, and we hope our oxygen requirements will be what? Met. Thank you. We turn round. The outpatient department houses also the emergency, the accident and emergency what? Unit. When there is an accident, the ambulance or whichever vehicle bringing the patient will come up here, and then the process of managing the patient begins. Now, in the outpatients, it houses a number of other specialized what? Services, besides general what? Outpatient services. We're just going to look at a few, but I know there is a bit of crowding. But what I want you to see specific is that we are moving outside paper to digitalization. What does that mean? If you come, your biodata is taken. What is your name, age, sex, where you're born, blah, blah, blah. And then from there, when you go to the lab, somebody just, the computer will be blinking. And when somebody checks, you just go with the number. And then they say, okay, hello, Peter, all your detail is what? Taken there. The clinician does is what? It makes lab requests of what prescribes. If you go to the lab, it is just your number. You find you don't have to move with the paper. But I want you just to see how that process is what? Emergency. I wouldn't want us to read. Like I said, after the information has been captured there, in every unit, you just go with your number. Once you put the number, your name and whatever is supposed to come out, comes out with a script. Prescription, whether pharmacy, or something like that. And that's where we're what? Moving. Okay? I think in short, other specialties, there is here a lab, X-ray, is it a pharmacy, something like that. For treatment and management of HIV and TB, we have what is called Lira Regional Referral Hospital Infectious Diseases what? Units. And this is the whole area. So people living with HIV seeking for treatment, this is where they what? Health education. How do we circumvent it? So that if it is like at night and you are not having what? This thing works 24 what? 7. Let's just pass through the video. When you have been assessed and given your bill, you come and pay here. And the payment is done digital. And then you are given your what? A simple receipt. Can you show us a sample if there is one which is here? Now, that also informs the clinician in the next step. You just go with your number and that is it. If it is for medicine, you have served your medicine since you have already made what? Your payment. Okay? Something like that. So what we encourage our patients is that no money should be paid to nobody unless it has this kind of what? Receipt. Okay?
What is the deal? It's not supposed to see, it's not supposed to take long. So now we have to print to go ahead. So it depends on the condition. If it is an abdomen, you can stop where the abdomen down here. This is brain, you bring it out. This one is the brain can stop here. So it depends on the condition where we are going to examine. Thank you. How long does a person take inside there? For abdomen, I think like 8 minutes. 8? But for brain, it's like 5 minutes. Okay. Yes. Abdomen takes down because we have to do it.
This is a building which is, what do you want to call it? Condemned. But because there is nowhere we can take the children, we have to be with them here. So, you have been seeing the good part. Now this is the other fairest part. So this is the award for the malnourished what? Children. Like I'm saying, this word is condemned, but we have said there is no way we can break it down when there is nowhere to take what? The children. You've seen the other ones. My duty has been done.
Well done.
Wrong, right?
Right.
Quick. Comprehensive or not, but at least we have had a snapshot of Lira Regional Referral Hospital.
How many have questions? One. Okay, we only have one question. Please say your question.
So, in short, a few that have been condemned for purposes of the new developments was this word what? Complex. That nutrition what? Unit. Because of the need to construct the what? The lab. Are we together? But we said no. There is a space that can house the lab. And even then, putting the lab here, then you have outpatients there. Patients would have trouble. The two would not be what? Communicating. So that's why we had to reserve this word, which is condemned, and then have the lab constructed there. However, though condemned, you've seen, because we don't have enough space to house the children and whatever, we are still using the what? The structure. And then given the original strength of the structure, that's why we are considering, like we have done all the others. This, like you are seeing, putting a coat, painting the roof, makes it a bit change. I was saying, those who knew the TB side, if you now see it's like a new one. So we also feel we can still put a hand, not major renovations, but basic, close the roof where there is leakage and then work on the ceiling, improve on the wall, and you have where at least you can what? Keep the children. I don't know whether I've answered you right, that how many? I would say actually all.
Okay, thank you, Peter.
That's why we are telling you that we need a word what? Complex. Now, if we got money to construct a word complex, this word here would go. This blood bank will go. This space here. Some of you are technicians, you know it. How much room does it have? And what can it what? And then you are going what? Area. So in terms of space, the hospital does not have, it's not that there is no space to construct what? A word complex. There is a space. It's a question of what? Money.
Thank you, Peter.
Resources.
We only had one question, and I'm sure we are done. Something. As the UCRI project, we are constructing 2 facilities within Lira Regional Referral Hospital. The first one is the Satellite lab that we have just toured, and then the call and dispatch center that's just next to the Satellite lab. So far, those are the 2 facilities that we have in Lira. The other facilities are in other regional referral hospitals. The ICUs in Arua, Hoima and Kabale, the neonatal intensive care unit is in Mbara Regional Referral Hospital. We have isolation units in Chisolo General Hospital and Rwekubo. We have 14 sites in a refugee district. So really the sites are scattered all over. We try to prioritize where we see that there's a need.
And then while making your presentation earlier on, you talked about the Ministry of Health intervention in constructing incinerators in that facility. We understand that there is one that was ongoing at a regional one in Lira, but as per now the work is stalled. What could be the challenge?
Well, that one I was not aware of, but the feedback I can give is let me take it upon myself and I find out why it's stalled and maybe who were the partners in that, then I can give an answer. Basically, we are here for Lira, so the other facilities I might not be in position to respond.